everyone, my name is Jessica and I'm presenting to you breast engorgement with twins for our course NSPN 7155, the breastfeeding experience. What is breast engorgement? When we look at breast engorgement, it tends to represent the breast fullness during the 2nd and 6th day after birth, which tends to become more tender and heavier breasts. The increase of this is from milk, blood flow, and lymph into the tissues surrounding the breast. It can then become quite enlarged and they can become quite sore. Breast engorgement can cause the breast to become quite round and firm. It can cause problems with latching, and it can be seen as redness around the area of the breast and also around the nipple. How does it happen? Almost always, some breast engorgement is considered physiologically normal. Each twin feeds differently from the mother's breast, and the breast can accommodate each babe's need. If you switch twin from breast to breast, it can cause milk confusion. Another cause is ineffective or infrequent breastfeeding, which can cause the breast to stay full of milk, causing milk stasis. As the pressure begins to build, proteins begin to seep into the breast tissue, causing swelling, and then as they harden, causing firmness. Other causes of breast engorgement are IV fluids, which a mother can receive during labor, switching from breast to breast during one single feeding, and delayed feedings, causing blocked milk ducts. As we look at signs and symptoms of breast engorgement, we can begin to see swelling, pain, tenderness, taut skin, shiny skin, warmth, fever, throbbing, and redness. As we begin to look at possible complications, if left untreated, we can begin to see feeding problems, weight gain issues for the baby, nipple pain, nipple trauma, mastitis, and poor milk production. As you can see in the picture on the left, mastitis can display lots of redness with stringy markings from the areola and the nipple. Solutions. When we look at engorgement and possible solutions, there are some. If treated promptly, breast engorgement can resolve within 12 to 48 hours. Some suggestions are anti-inflammatories, cold compresses to loosen the hardness, frequent breastfeeding, expressing your breast milk, cool cabbage leaves, ultrasounds, or manual lymphatic drainage therapy. The following video has been put together from YouTube and retrieved by me as cited in the references, which explains what breast engorgement is, how it is natural, and ways in which you can avoid it.
So avoiding engorgement, really the best way to avoid engorgement is quite simply to feed frequently. In the very, very beginning, when your milk first comes in, you are going to be engorged. Your body's not quite used to this onslaught of milk that it's starting to produce, and the baby's not taking as much as you're producing. After a few days, you actually start to even out. Your baby will start teaching your body how much it needs to make. So in the beginning, there's a little bit of an, I would never even say an oversupply, but there's much more in the very beginning, which leads to engorgement. And a lot of times, if you're not relieving that by the baby feeding or the baby finishing an entire breast, we can end up a little uncomfortable. But if you do become engorged, there are very easy ways to manage it. Again, aside from feeding frequently, the milk is all stopped up in there. So a lot of times, many women will put the pump on and say, I'm going to pump out everything now, and then not a drop comes down because we have to relieve the swelling first. Engorgement is not just fullness, it's rock-hard breasts. And so we need to be able to relieve that swelling before we can let the milk come down. And ice packs will do that. Frozen vegetables are fine. Any special ice packs that contour the breast, even better. And it doesn't mean that you're going to leave it on there for 1 minute. It means you're going to need a good 20 minutes to keep the ice on there, reduce the swelling, and massage around at the same time. Once you feel the breast softening, then get into a warm shower and let the milk flow, and then you can put the baby on. But do not put any heat on an engorged breast because that's just going to blow it up even more. It's going to be like a swollen ankle. So those are the best ways to avoid engorgement.
So everyone, that's it for breast engorgement. Following are references at the end of my slide, and the slideshow plus the link you can find on our NSPN 7155 posting site for this presentation. Thanks everyone.